For those of you that don't know me, my name is Cindy Ballor, and I'm the clinical coordinator for the ultrasound program and also one of the instructors. Today I'm going to talk about pancreas, and we're going to learn a little bit of the anatomy and how we see it on ultrasound. So this is an anatomical drawing of the pancreas, and it's located right here. And there's different segments of the pancreas. We have the uncinate process, which is a hook-like projection. And we have the IVC, the aorta, and then the head of the pancreas, which is over in this area. Then there's the neck, and the body lays right up here. And then we have the tail. And then also within that, there's the common bile duct, which is right here. And on ultrasound, it's seen more on the posterior portion of the aorta. And then you have your gastroduodenal artery, which is more on the anterior of the head of the pancreas. And then you have the pancreatic duct. So I'd like you to take your paper, and we're going to actually draw a pancreas. So the pancreas does come in all different shapes and sizes. So if yours looks a little different, that's okay. But what we're going to do first, we're going to draw an upside-down U. And on ultrasound, this is the spine shadow. The bone reflects, we just see a spine shadow. Then above that is the IVC. And over to this side is the aorta. Now from the previous lecture, what plane am I scanning in? Transverse, good. Because these are circular, right? They're round. So this is anterior, because we're coming from the top of the patient's body and going through. So this would be posterior. And what side is this? Right. And this is left. Okay. So it looks like we sort of have a little sad face going on there. So this is spine shadow, IVC, and aorta. Now above that, what artery did I say looks like a priest? It has the white superior mesenteric artery. So right above there. So now you're going to draw the hook-like projection, and that's the uncinate. Then you're going to go around like this. So what part of the pancreas is this? You get the head of the pancreas. And then what little circular thing was down here that I said was on the posterior? You guys are great. Good. Yep, common bile duct. So when we're looking at the pancreas, we're trying to rule out any abnormalities or any disease, make sure there's not carcinoma in the head of the pancreas. The main goal for ultrasound is to let the doctor know if there is abnormal variances or if there's abnormalities, where is it located? You are going to be the GDA, CBD. Okay, so if everybody would like to stand up, and we're going to go ahead and place ourselves in the pancreas. Everybody set? Okay, so we have the upside down U, which is the what? Spine shadow. And you are the IVC, common bile duct. Yes.
The pancreas unicell process.
And she's the hook-like projection. And with the fatty collar is the SMA. Okay. Splenic vein, pancreatic tail, portal splenic. You're going to come right over here. She is the splenic vein, and then you are the portal splenic confluence. Okay. You are on the right side, correct?
I'm ahead.
Pancreas head, GDA, neck, Good. Okay, great. See, but this is just a really good, I actually had a student tell me afterwards that when she was taking her test, she was thinking, where was I standing? Where was I, so I think it really hits home.